Hello, everyone. This is Todd Brow with Senior Insurance Marketing, and welcome to our webinar today. I'm excited for this webinar. We have a great tool that's going to be easy for you to do business with from Medicare Advantage, as well as prescription drug plans as well too. It's going to be easy, and it's a tool that you need to add to your toolbox, and it's going to make life a lot easier for you. I've just seen a snippet of it, and so I'm seeing this the full version of for the first time as you are as well too. So I have Brandon Reid and Bradley Wooten with us today, and they are going to talk to us about Connecture, this one tool platform to help you with your MA and your PDP plans as well too. And so if you have any questions throughout the presentation today, please put it in the question and answer box, and we will monitor that and then answer your questions as we go along here as well too. So without further ado, I'm going to swing it over to Brandon and Bradley. And gentlemen, take it away and tell us more about this exciting platform that we have.
All right, everybody. Hello, good morning, and thank you all for jumping on this training. I'm honored to be a part of this. My name is Bradley Wooten. I'm the National Broker Director here at One Life America, and I'm going to be demoing a live version of our Connecture DRX platform, which is called Plan Compare One. So we typically call it Connecture. So if you hear me call it Plan Compare One and Connecture or DRX, it all means the same thing, right? So I'm going to be demoing as if I was in the field as an agent, just as you. I very recently came out of the field about a year ago to take this new position here at One Life America and help grow Medicare Advantage sales. And if I would have had this tool while I was in the field as an independent broker, it would have made life a lot easier for me to keep things in order. I will let you know this, a quick disclosure. This is not your typical CRM like Salesforce or Agent Cubed. This is going to be something, it's going to be your online profile database. So if I have Brandon Reid, who is a prospective client, I'm going to be able to build his profile, add his prescription drug list, edit, change that prescription drug list throughout the year. That way you don't have to add prescriptions every single time that you go out and see your clients. You can just pull their profile up, and I'll show you how that works. You can also do scope of appointments. You can print paper scope of appointments, you can email, or you can text to sign scope of appointments as well. And that goes also for signing the application. Text to sign the application and email signature as well. Now, there are a lot of things that are on the roadmap for end of Q1 this year and the end of Q2 this year for Connecture to release. So I can't really talk about those yet. Just know that there are going to be some major enhancements. And just as Todd said, if you have any questions, please feel free to put those in the chat box and I can answer those as we go on. So what we're looking at here, everybody, is the registration page. As you can see, it's pretty simple. Now, there are a couple of things about the registration page that I do want you guys to understand. First off, when you choose your carriers, make sure that you're only choosing the carriers that you are already ready to sell for. So that means that if you're going through contracting for Aetna right now, when you come and do your registration request, please don't choose Aetna until you are ready to sell. If you choose a carrier that you are not ready to sell and we cannot verify that on our ready to sell reports directly from the carriers, we will not grant you those permissions. Okay, you'll have to go back and do the registration all over again for those carriers that you do become ready to sell for in the future. So that's number one. That's golden rule number one. Number two, everybody on this phone call, when you do your initial registration request, are going to choose no. Even if you are on a telesales campaign, you are not working in our Kansas City headquarters call center. So everybody here will choose no. And basic, simple information, first name, last name, your email address where you want your registration link to go to. And if you all want to write this down, and Brandon, in fact, if you could write this down in the chat box for me, buddy. Everybody, when you come in here and you submit your registration request, which I'm going to go over a couple of things, it's going to take us anywhere from about 24 to 48 hours to process that request and then get you your email. That email is going to come from donotReply@reaganai.com. Make sure you check your junk, your spam, your deleted folders, depending on your filters. That do not reply at Reagan AI email with your login info and your password and username are going to go to that folder. And I can't tell you how many times somebody has told me that they never received their email, but they didn't check their junk or their spam. So give us about 24 to 48 hours to process that request. When you receive that email, if you read the instructions carefully, the email is going to say, please give another 24 hours, a maximum of 24 hours, in order for you to gain access to the system. Unfortunately, Connecture has it set up to where we can't just grant access immediately. It's got to go through some compliance rounds and go through some verification checks before we can grant you that access. Okay, so right now we've got roughly about 12 carriers on here. We are working on 4 more and getting added, and we are adding carriers every single month. I can tell you that the other carriers that we add, there's 2 regional and there's 2 national carriers that are going to be going on there. As soon as they go on there, I'll send an email out to Todd. Todd will be able to then email blast all of you. If there's a carrier that's not on here that we do add, you can go on there and request that carrier at that point in time. Okay, so you're going to put in your writing numbers, just hit submit. It's pretty simple. Again, please do not choose any carriers that you're not ready to sell for. Okay, once you become ready to sell, you guys can save this link, which Brandon and I are going to send to Todd, and Todd's going to blast that out to all of you. And you just go on here and register, and you'll have access within about 72 hours to get on this platform and start enrolling, quoting, sending out your personalized URL, which I'm very excited to show you, and building your prescription drug database. Okay. So before I move on to the actual portal itself, does anybody have any questions on the registration page? Any at all?
I don't see anything,
Okay.
Bradley. So yeah,
No problem.
but if you do have questions, let us know. I guess, and maybe you mentioned this, Bradley. So once you get registered, and then, so what's the process if you do get contracted with another company? How do you go about adding that company to this system here once you've already been registered?
That's a great question, Todd. I'm glad you asked that. So everybody, whenever Todd blasts this DRX link out to you, which is right up here, as you can see highlighted, save that to your favorites, because anytime you get a brand new carrier, all you have to do is come right back to this registration link and just go over here. And let's say I already have Aetna, Anthem, Humana, and Bright Health. I want to add Cigna and Devoted. I don't have to go back in here and add all my carriers that I already have and I'm already registered for. So you just come in here, choose Cigna, Devoted, and let's say WellCare. Come in here, put in the Cigna writing number, whatever that may be, and just hit register. So anytime you guys get new carriers that you're ready to sell for, just go back to your favorites, click on this link, and then add the new carriers. Don't worry about adding your old ones because we already have that request and it's already been processed. Does that answer your question, Todd?
Yes, it does. Great. Thank you.
Very good. Awesome. Yes, Eric, same way with the new states as well. That is correct. And you're going to want to choose the carriers that you want in those states, especially your non-resident states. Can we go into this page after we are already completed this step? Yep, you can always go back to this page. That's why I just say save it to your favorites up here. That way, whenever you get a new state, you get a new carrier, you just go right back to this link, add the carriers and add the states that you want. Any new states that you get, you are going to need to add those states and add those carriers again. If you have questions, please feel free to reach out to Brandon Reid or myself, and we'll be more than happy to assist you guys. So onto the actual portal. This is what your login page is going to look like. Okay, it's much different than what it was for 2020. And one other thing on the registration page, I wouldn't bother looking at this training video yet. We haven't been able to get a new video up yet from Connecture because this is a 2020 platform and a 2021 platform looks completely different. So don't worry about watching this video because it really won't help you at all on the new 2021 platform. We will be updating that this month. So when you get here, you're going to log in. It's pretty simple. Right. The first time that you guys log in, please feel free to go to your actual profile, your account settings, and go ahead and change your password if you want, or you can leave your password. We don't require you to change it upon your first login, but if you feel more comfortable that you would like to do that, please feel free to do so. So when you first log in, number one, it's always going to bring you to the search beneficiaries page first. Okay. So if you have an active profile in here, right, you want to come in here. If you're talking with somebody over the phone who wants you to come out during the pre-AEP, right? You already have a profile built for them. You already have a prescription drug list in there. Maybe you already have their LIS levels and their Medicare Savings Program level in there. You can just come in here immediately, type in the name, and it's going to bring up that profile for you. However, before I do that, I would like to show you a couple of bits of information that you're going to want to look at when you first log in. Is going to be your account overview. Okay. Now I'm set up at an admin level, so my system is going to look just a little bit different than what yours is going to look like, of course. But you guys are also all going to want to come in here and make sure that all of your personal information is correct. Because if you make sure that this personal information is correct, when you send your personalized URL, which is my shopping link, which ties any piece of business, if you send this personalized URL to Todd and Brandon or myself, and we all enroll, you guys automatically get credit for it. You get your commissions and your renewals whenever that policy renews. Okay. But when you send this personalized URL, up at the top right-hand corner, when your clients are inside of your personalized URL, your personal agent contact information is going to show up right up here in the top right corner. So if they have questions, they're not clicking on the contact us and calling some 800 number. They're going to see your information, and I'll demo that here for you very shortly. It's going to have your name, Bradley Wooten, email address, and phone number. So you want to make sure that this information is correct. Okay, your account information, you can change your password at any point in time that you would like. You guys won't have revoke access because you're not set up at the admin level. And you can also come in here and put in your agency name and agency ID if you want to. It won't allow me because I'm set up as an admin. But just make sure that all this information is accurate. Also, what you're going to see that you don't see on my screen is another page where it's going to show you all of your states and all of your carriers that you're successfully registered for. And it's going to show you everything right here on the bottom of the page. So if you have 30 states, it's going to have all 30 states in there, and it'll have Humana checkmark, United Healthcare checkmark, WellCare checkmark, so on and so forth. Okay. I can't demo that for you, unfortunately, because I'm set up as an admin. But the first time that you log in, make sure the first thing that you do is come in here and go to your account overview. Okay. Make sure all that information is accurate, and put this, if you guys have your own website, right? Put this personalized URL on your website. Start blasting it out to your current book of business. Have them build some profiles, because if I build a profile from your personalized URL, whatever I do to build that profile shows up in your broker portal. So this is a very good way to work with your current book of business that you already have that are not in the Connecture platform. So I could send it out. When I was an independent agent, I had a book of business of about 358 agents. That was right before I became a Humana career agent. If I had this, I would have contacted all of my people, because I like to maintain contact, right? That's why we're paid renewals on the Medicare Advantage side, is to service our book of business. I would contact them and let them know, hey, I'm going to send you a link. And within that link, ladies and gentlemen, I want you to go in there, build your profile, put your address, put your phone number, put your prescription drugs in there. That way it shows up on my end. So every single year, when you want me to do a policy review for you during the pre-AEP, which is October 1st to October 14th, I already have your profile built and I have all of your prescription drugs. At that point in time, I can add, delete, or edit or change dosage or quantities of your prescription drugs on the fly. So it's very handy, and make sure that you utilize this personalized URL. Just to show you what I am talking about. I already copied it. Okay. It used to be an actual link, but people were highlighting the link and then copying the actual link and then pasting it, and it was breaking the link. So just come in here and hit copy. And when you pull it up, this is what it's going to look like. I want to show you what the consumer facing portal looks like first, because it's important for you to understand what they're going to go through and what they're going to see on that consumer facing portal. So Brandon Reid has sent me, well, let's say Bradley Wooten, it's me, but Brandon Reid sent me his personalized URL. Brad, go in there, shop around, build your profile, add your prescription drugs. But if you have any questions, just look up in the top right-hand corner. My agent information is up there in case you ever have any questions. And anything that you do in here, Brad, is directly tied to me and my license and my contract with that carrier. So if you end up signing up for a plan, I am automatically granted agent of record for you, and I'll be able to answer your questions and service you throughout the year. So there's a couple of things, right? We have the cart. So whenever you actually find a plan that they're interested in, all they're going to do is hit add to cart and then actually go to the shopping cart and then fill out the application if they decide to do that. Or preferred way is for the agent to complete the application. That way there's no errors or inaccuracies on there that could possibly pend that application with the carrier or with CMS. But right off the bat, they can quote Pinellas County, Florida, right? Everything that I do in here, I will be able to see, or Brandon will be able to see in his broker portal. So this is 33756. This is Clearwater, Florida, Pinellas County, Florida. As you can see, the plans are absolutely stacked. We've got 5-star opportunities here, which are year-round selling opportunities. We have, it seems like, an infinite number of D-SNP plans, C-SNP plans available in here. We even also have I-SNP plans, which are institutionalized special needs plans, but we won't go over those. So right now, this is all consumer facing, ladies and gentlemen. And let me see if I can get that to be a little bit larger. Okay. So going through here, a couple of things. They can compare up to 3 plans if they want to compare. Well, let's not do the D-SNP. That's not going to be a good comparison. Sorry about that, guys. All right, so we're going to go back if I can operate the system properly. So we're going to say we want to compare these 3 plans, right? At any point in time, they can enroll. Now, obviously, they have to have a valid election period to enroll, such as a SEP, OEP, IEP, ICEP, AEP. However, this is going to give you a side-by-side comparison of what we call the BAAG, the benefits at a glance. The benefits at a glance, if you look at it, are typically the most utilized benefits on a Medicare Advantage plan. So it's not the summary of benefits, which we can get to in one click from here, but it's going to compare the most utilized benefits on the plan, right? So if you look over here, out-of-pocket maximums, right, $1,200. That's going to be a WellCare Elite HMO. Their networks aren't that good down here, but it's got great benefits. But look at this inpatient hospitalization copayment. It's a $20 copayment per day for days 1 through 5, right? So you can go in there and take a quick look at what their most utilized benefits are going to be, what they're going to cost, what their cost share is. It's also got the prescription drug coverage stage, right? Deductibles, no deductibles on the MAPDs here for prescription drug coverage. It's got the initial coverage limit, right, which we'll go over. And then if you want plan documents, right, you want the summary of benefits, they want the EOC, they can just go to view details. And then when you go into view details, ladies and gentlemen, that's when it's going to give you the deep dive into that one specific plan, right? So I'll demo that here for you in a second. Probably one of my most favorite features on this platform is provider directory. No longer do you have to pull up and say, well, I need to make sure that your doctor is in the network, right? And then you go to humana.com and you go through the entire process of just trying to get to find a doctor, right? So now I can just go provide a directory, straight to it. Care Plus, provide a directory for Humana. It brings you right to it. You don't have to navigate anymore. Everything is going to be 1 to 2 clicks away from you at any given point in time, which is what I like. So 33756, we can do the radius up to 20 or 30 miles. We're going to look up by Medicare, Medicaid, right? It's that quick. That's going to make you very efficient while you're in the field, which is the name of the game for me, right? I want to get in, spend some time with them, sign them up, and get out and on to my next one. So obviously here, I'm not going to go through the entire process because all of you know what this looks like, but that's what I wanted to demo for you, is this one button access to wherever you need to get. Prescription drug directory. Right? Are my drugs covered? Lisinopril, 20 milligram tab, 30 per month. See if this drug is covered. Very quick, right? And this is without building the prescription drug list. This is just checking really quick on what you want to see. This is a retail cost. This is what they would pay. It's a tier 1 preferred generic. They pay nothing during the gap. After the gap, they would pay a $2.24. Everything is right there. And this is consumer facing. Remember that, not broker facing, okay? So pharmacy directory, we all know what that's going to be, okay? Let's go down here and let's just go to plan details for the Care One Plus. To give you a full entire, this is a full entire breakdown, all the plan documents as well. Now, as you can see, I feel like that might be a little bit too big. Is that better? As you can see, this has pretty much almost everything from the summary of benefits in it. That's in the view plan details, okay? Out-of-pocket maximum for in and out of network, right? Here's your pharmacy deductibles again. This is what their tiers would pay, or this is what they would pay as their cost share for their tiers. That's preferred pharmacy. This is standard pharmacy. Mail order preferred cost sharing, standard mail order, right? And here's your anti-discrimination disclosure, which we're always supposed to make a quick disclosure about. Humana, United Healthcare, Aetna, WellCare, or myself will never discriminate against you for any race, creed, religion, or color. Just a required disclosure. You want the summary benefits? It's right here. All right. Everything is right there within one to two clicks. The EOC, you want to pull up, you don't know where they're going to pay a $0 copayment for diagnostic imaging versus a $95 copayment. Control F, and you just go to chapter 4. All right. Well, actually, that's going to take forever, but you get what I'm saying. Chapter 4, if you are not aware, ladies and gentlemen, of the EOC, houses all of the healthcare benefit information for a Medicare Advantage plan. So you can just skip straight through and go to chapter 4 if you want to, okay? Star ratings, we got to cover the star ratings with them. All right, this is a 5 out of 5 stars, so it's a year-round SEP selling opportunity, and there's an ANOC as well in here. Okay, everything that you need, one click away. Again, provide a directory. You want to go look up doctors, provide a directory right there. Prescription directory, so on and so forth. So that's the broker. That's the consumer facing portal. All right. If they want to, they can add to cart. All right. I call Bradley, say, hey, Bradley, I think I'm going to enroll into the Care One Plus HMO. Should I do the application, or do you want to do the application for me? Right. Guys, I'm just going to let you know this right now from 10 years of experience in the field as a telesales agent, independent broker, and a career Humana agent. You guys should be trying to do the applications for your clients. It's going to help out with pending applications, because our seniors, sometimes they put typos in there. If they don't put the proper information in from the Medicare claim card, right? It's going to take forever to get that application fixed. Now you got to circle back and fix it. So if you have somebody that you believe is competent, absolutely allow them to do the application. But I would highly recommend that you check within 48 hours after that application has been submitted to make sure that it's getting processed successfully and it's not pending for any errors. That's just a quick tip. All right, so that's the personalized URL shopping link. Every single one of you will have access to your own personalized URL, or your Pearl is what they call it, right? Your shopping link. Put this on your website, ladies and gentlemen. You can put it on Instagram. You can put it on Facebook. All right, people can go on there and shop till they drop. You're not talking any plan specific benefit information. You're not marketing. You're just giving people access to your customer facing or consumer facing electronic enrollment form, and also scope of appointment and everything. So we've covered everything on a My Account overview. Let's go back and look at a couple of the other features. So in the search, we can either search beneficiary, or I could search you as an agent, as an admin. So you guys will most likely be using search beneficiary. If you want to build a new profile, right? I just met Todd. Todd's a prospective client for me. I'm going to come in here and we're going to create a new profile. And as you can see, there's a notes section here for you. So if I want to put a note in here, Todd is going to doctor on 26, right? Call back and see if new meds are prescribed, right? I mean, there's any type of different variation that you can use with these notes. And then tasks, okay? Tasks, you can set a reminder. So every time you log in here, if you have a due date and that task is there for that due date, it's going to notify you immediately upon login, so you don't forget. So you can cover that. Add zip code, first name, last name, home address, right? This is always going to be no unless they're a durable healthcare power of attorney that is court ordered to make healthcare decisions, of course. And then additional information. I don't suspect you guys will be using these additional information boxes because you already have your note box over here. Okay. But let's say that you build a profile. You can add the preferences and then go to scope of appointment. After you complete the scope of appointment successfully, then you can go to the quoting area, which is continue the plans. But for the sake of time, so I don't bore you guys too much, let's just go here, because there's already a profile built, right? So this one is going to be, give me 1 second, guys. I'm so sorry. That should be that one. All right, so we have a profile. I spoke to Brad before. I know for a fact that I have a profile in here, so I go in here and I search. All right, we have Jackson, Missouri. That's not my zip code, but this is a demo profile. So if you do a quote, so if you send them a quote to their email, it's going to show you sent Bradley Wooten a quote on June 15th of 2020 at 10:28 a.m. It's going to show you a digital paper trail of all of your quotes and all of your enrollment applications that you do through Connecture. Okay. If you don't do the quote or the application through Connecture, ladies and gentlemen, it will not show up here. It would have to be done through the Connecture Plan Compare One platform. I just want to make sure that I'm being loud and clear in that. So let's say I want to do a scope of appointment, which is what we need before every single Medicare Advantage or prescription drug plan appointment. Okay. There's no scope of appointments for this profile. So now for a fact, I know that I chose the wrong test profile, but that's okay. I can demo one for you live. So as you can see in scope of appointment, there's 3 options, ladies and gentlemen. Print a consumer form. Okay. This is your portion to complete as the agent. The scope of appointment is not complete until you finish to be completed by agent. Always remember that. All right. So you can print the paper form, have them sign it physically. And then once you get back home, you can scan it into the system and then upload it. So everything is kept within that individual profile. And I also recommend you keep a paper copy of that scope of appointment as well. If you do a paper copy, make sure you keep it under lock and key for at least 10 years. Just a quick compliance disclosure. If you want to email it, you can email the scope of appointment. So that looks just like this. And I've got to wait for a second for that to pull up for me. And I like to demo it so you guys see what the consumer sees. So let me drag it over. So Bradley sent me a scope of appointment for me to fill out. This is what your consumer is going to see. All right. The agent information, ladies and gentlemen, for a quote, for a scope of appointment, all of your agent information is tied to everything for that individual profile. Okay. Complete scope of appointment form. This is what it looks like to your consumer. It's very important, ladies and gentlemen, that we get them to check mark all 4 of these boxes. If you get them to check mark all 4 of these boxes and they have a question on a Medicare supplement plan or one of our favorite, Heartland National Life's hospital indemnity plan, you don't have to go back and collect a new scope of appointment again and have them check mark these boxes. You've already got all the products offered or all the products check marked. Okay. So a couple of things. We're just going to name this James O'Keefe. And we're just going to do 1, 2, 3, 4 Main Street. And that'll just be, let's just do Clearwater, Florida. All right. They are not going to choose yes, ladies and gentlemen. Again, another compliance disclosure. They will only choose yes if they are the durable healthcare power of attorney that is court ordered to make healthcare decisions. And only if that individual is not competent enough to make their own healthcare decisions. Just another quick disclosure for you in there. So that's going to be a no, and then submit form. Okay. So make sure, ladies and gentlemen, make sure that when they sign the application, they sign a scope of appointment form, make sure that once they do it, they exit out. That helps the system speak to each other faster. Okay. Hang on. What specific statements do you say when you're sending this to the customer? Personalized shopping link or something else? Eric, I'll go over that with you a little bit later on in the training. Okay, that's a great question. So if you don't see the scope of appointment pop up within like 10, 15 seconds, or if you're just running short on time, just come up here and hit the refresh button. And voila, completed by James O'Keefe on 2/24/2021. That scope of appointment is now going to be in here for the entire life that you have a profile here. All right, now you can have a quick glance. Okay, James did select all 4 boxes. Great. I'm going to try to sell him a Medicare Advantage plan, and I'm also going to try to stack that with the hospital indemnity plan. All right. Now, remember what I said. Your scope is not completed unless the agent completes it themselves. All right. Initial method of contact, let's just say health fair. I met them at the health fair. We do not have to worry about this, ladies and gentlemen, because we can collect them. We can collect scope of appointments right up until we start discussing Medicare Advantage benefits. We do not have to collect scope of appointments 48 hours in advance anymore. Thank goodness. CMS is starting to get a little bit more lax on their rules and compliance regulations, okay? Plans represented, we're just going to say Humana, UHC, WellCare, or if you already know the specific plan that you're going to write for them, you can just put in here Humana Gold Plus, HMO H1032-025. All right, that's one of our best HMOs here in Pinellas County. Date the appointment is completed. Guys and ladies, if you don't close the sale on today and you go back tomorrow, guess what? Today's scope of appointment does not authorize you to do the application tomorrow unless you collect a new scope of appointment for the new presentation that you're going to be doing. Okay, just trying to make sure that we're all remaining compliant. Check mark this box. They can sign with their mouse, which I'm horrible at it, so I apologize. Submit broker form. There we go. Once you get a green check mark completed, you are now good to go. You are now 100% compliant. We can now move on to add preferences, which is what you're going to want to do. Okay. Somebody had their hand raised. Oh, Eric, you already asked that question. All right. I'll get to you on that, Eric. I promise. All right. So let's say you want to come back, or let's say, God forbid, but let's say that there is a Section A allegation placed against you, right? And CMS or Humana or UHC is requiring the scope of appointment. Hit view, come down here, double click. We have the scope of appointment. It is completed. Okay. Now there's your information. Everything is correct, signed. All right, we're good. We're compliant. Save it to your desktop. Send it on out with your Section A response. Nobody's going to get a Section A here, though, so don't worry about it. All right. So phone number. Is there anybody that would like me to send the scope of appointment to their phone, to their phones, that way they can see what it looks like? Because I can't demo that for you on my phone. I don't have that ability. Todd, maybe I can send it to you. Are you okay with that?
Yeah, that'd be fine.
Okay. What's your number?
402-432-6234.
So that should be there. Again,
Okay.
He'll get a regular old text message. He can pull it up. It's just a quick link. It's going to look just like this, just on a mobile platform, right?
And I have it here too.
Perfect.
A little bit.
Yeah, I don't know why it doesn't catch your phone screen. That's kind of weird.
Yeah.
But Todd would just fill it out, then notify me once he fills it out, exit out of that browser, give it like 5 seconds, come up here, hit the refresh button, right? And it'll say completed by Todd, or in this case, it would be under this person's name, James O'Keefe, but you get the picture. So now we're compliant. We've got the scope of appointment form. We don't need to print. We don't need to upload. Let's go to add preferences. Okay. Now, this is in a profile that maybe you don't already have the preferences, or this is when you built a brand new profile. This is following the exact same process, which is the reason why I do it this way. So 64081, that's Jackson, Missouri. We don't want an MA only plan. We're not dealing with a veteran who has the VA, who utilizes the VA for their creditable prescription drug coverage, right? We're not looking for a standalone PDP, at least not yet. We don't know. And we're looking for medical and prescription drug. We are working, ladies and gentlemen, and I know everybody probably has this question brewing in their mind. What about med subs? Med subs currently on this platform, Connecture is revamping their contract system with the carriers directly, because some carriers have a separate contract for med sup and a separate contract for Medicare Advantage, and it just gets really convoluted. So more to come on the med sup aspect, but this is going to be standalone PDP, MA only, and MA PD. Okay, so we're going to say we're looking for medical and for prescription drug. All right. Two of my favorite questions that I ask when I'm in the home, Mr. Smith, do you pay your Medicare Part B premium, or does the state pay your Part B premium for you? That is going to tell you if the state is paying the Part B premium for them, that means that they have Medicare Savings Program, which also means that they have LIS as well. Okay. So that's the first question. My second question is, what do you typically pay for your medications when you go to the pharmacy, Mr. Smith? Right? Are you typically paying a $3.70 copayment or a $9.20 copayment for some of your drugs? If yes, they've got low income subsidy. Okay, you're going to want to call the insurance carrier at this point in time, or you probably should have called the insurance carrier or verified through the DSNP eligibility verification tool already. But if you're not sure, always call. And I'm just going to tell you this right now. I prefer Humana over every other agent support DSNP verification check. Agent support for Humana will give you the proper Medicaid ID number. It'll give you their LIS level. They'll give you the MSP level, which is the Medicare Savings Program level. And Humana will also tell you what specific DSNP plan that individual is eligible for. Because here in Pinellas County, Humana has 3 DSNP plans, which can get kind of confusing, right? One's going to take QMB plus and QMB. The other's going to take FBDE and SLMB plus, whatever it may be, okay? So when you are in doubt, ladies and gentlemen, do not ever guess at their Medicare Savings Program level. Always verify it first. That's a misrepresentation of benefits and what they're eligible for if you do not verify it, and you're incorrect if you try to guess at it. All right. So very rarely are you ever going to choose supplemental security income. All right. Now, for the sake of the entire presentation, I'm not going to add a subsidy, because if I were to add the Medicare Savings Program, it's going to show me all of the subsidized co-payments for my prescription drugs. And I want you to see what the retail cost and the regular cost sharing on a prescription drug plan looks like on here. But just know that if you choose LIS, or if you choose Medicare Savings Program, Medicare Savings Program or extra help through Social Security, it is going to show those subsidized co-payments on those prescription drugs, which is very helpful. However, for the sake of the example, I'm not going to add that. All right. So we're just going to say, no, I'm not eligible for special assistance. All right. This is a tab that I don't really pay attention to, ladies and gentlemen, and this is why. Any experienced Medicare Advantage producers here will tell you, we are not allowed to ask about their health. Mr. Smith, how many times do you go see the doctor? That could be misconstrued as cherry picking. Now, if MedSup is in the conversation and they have to be underwritten, obviously we have to know about their health. So there are ways to toe around that line. But when we're dealing with Medicare Advantage, like it's just going to be a Medicare Advantage plan, I typically put some health needs. Like if I know they tell me I've got diabetes, I've got congestive heart failure, maybe they have COPD, right? Blood pressure problems. That's going to be significant health needs. However, we do not ever quote on the actual estimated annual out-of-pocket healthcare costs. We don't know how many times a year I'm going to go see my primary care physician. We don't know how many times a year I'm going to go to the ER. We don't know how many times a year I'm going to be inpatient at the hospital. So don't quote out-of-pocket healthcare costs. Quote what the co-payments are and leave it at that. And I'll show you what I mean here later on. And then age. I've been with 85-year-olds. I've been with 92-year-olds that aren't on any medications. So this tab right here, they make you go through it. I would not pay too much attention to it. Just a heads up. Okay. So we're going to continue. Now, the best part about this platform, if they have a mymedicare.gov account and they have their email registered to that account, you can actually send an email to their inbox. They can fill out that email that you sent out, and Medicare.gov will automatically share their entire prescription drug list with this platform. So make sure that you always ask that question. Hey, do you have a mymedicare.gov account? Like, have you gone on to Medicare.gov and created an account and added your prescription drugs? Most of the people are going to say no. In my experience, it might be different for some of you, but it's worth a shot because it could save you quite some time, but not adding 10 or 15 medications. So let's say we've got Advair, Discus, right? Now we're going to say it's a blister pack of 60 aerosols. It's a 500 over 50. Oh, but wait, there is a direct generic to Advair. Make sure you always ask this question. And if you're new to the Medicare Advantage game or prescription drug plan game, ladies and gentlemen, always have them grab their prescription drug list, or better yet, their prescription bottles. A lot of them will bring a shoebox down. They'll have to go get it from the refrigerator if it's insulin, so on and so forth. But always verify this information. You do not want to misquote and misrepresent benefits, okay? So let's just say, yes, I am actually taking the fluticasone, the generic. We can add that. We'll add a couple of simple medications. If you've been on Medicare.gov before, ladies and gentlemen, this is the same company that created the Medicare.gov platform, by the way. All right, so we'll say we're taking 30. We're doing 3 months. Let's do enroll. Very expensive medication. We'll add that one. Let's do albuterol, another inhaler. Where are you? Okay, so we've got Enbrel, fluticasone, lisinopril, albuterol. Let's do atenolol. Hydrochlorothiazide. Okay, so we have a pretty big drug list here. All right, so we're going to go to continue. Next is going to be pharmacy. We want to choose their pharmacy because we want to know if that pharmacy is going to be preferred cost sharing or a standard cost sharing pharmacy. Big difference a lot of the time. So always verify that. Let's just say we are going to CVS. And now after the pharmacy, this is when it's going to pull you to the quote based upon all of the information that you put into the preferences. Okay. And this information is actually pretty accurate. So remember this, we always go by the estimated annual drug cost. We do not go by the total estimated annual cost because the total estimated annual cost also includes the health costs as well, right? The hospitalizations, the doctors, the specialists and stuff like that. So always just, you can quote this and you can feel very, very comfortable and very safe, and you know that you're protecting yourself because you're not quoting this number, right? 6 of 6 prescription drugs are covered. So we know that all 6 of the drugs are covered on that specific formulary. 6 of 6, 6 of 6. Let's see. I was hoping that there would be a couple of plans that didn't cover the Enbrel. There we go. 5 of 6. So you'll know when you're looking at a quick glance right here, you'll know if all 6 drugs are covered, and you'll know if it's a preferred in-network pharmacy, right? So again, this is all broker facing. This is your portal that you're looking at. So let's say we're going to compare this one, and this one. Obviously, the prescription drugs are pretty close, right? This is the PPO plan. Health costs, look at that. $560, $853, $601. Don't quote that, ladies and gentlemen. Okay, please don't quote that because we don't know how many times they're going to use their plan a year. But what we do know, because all the information is based off of actuarial information directly from the carriers that upload all this information specific to each carrier, we know that this is pretty accurate. This is always an estimate. Okay, so I like this plan. I like the Humana Gold. I like the Humana Community HMO. Okay, we go over everything. And let's say I want to send a quote. You can send a quote with up to 3 plans at any given time. All right. So when you send a quote, remember this. They're going to get 2 emails when you send out a quote to them. 2 emails. The first email is going to be the actual link to get to their quote. The second email is going to be the authorization code that they have to put in order to get into that quote. The reason why there is an authorization code is because that authorization code is tied to this profile. You don't want anybody just being able to open up some quote that has all of their prescription drugs built into that profile. That's a breach of personal health information and personal identifiable information. That's a HIPAA law. Okay. You can type in your own personalize your message, right? Whatever you want to put in there, it's going to show you the plans that are selected. Send quote. Keep this up when you send the quote, because we know how seniors can be. The information can be right in front of them and they don't see it. I mean, if you ask my wife, that's the same with me sometimes, but that's that's another topic for another discussion. But you get the authorization code. Let me show you this right here. It'll be easier just for me to show you. So 2 emails, ladies and gentlemen, and let me see if I can make this bigger. Nope. All right. Customer completed SOA. So you get an email on that. And you also get the authorization code. Okay. And the other one has not come through yet. That's not normal, but it will come through. I can assure you of that. So, give me 1 second. All right. So you sent them the quote. As soon as that comes through on my end, I'll show you guys that. I promise. So you send the quote out, even if it's a 1-plan quote, 2-plan, or 3 plans, they're going to get 2 emails, authorization code and the link to get in there. So let's say I like the Humana Community HMO. I want to take a deep dive.
And Brad, a couple questions in the chat box when you get a chance.
Yeah, please go ahead and ask.
First question from Eric. Do those estimated total costs include or not include extra benefits?
Eric, can you be a little bit more specific on the extra benefits? Do you mean like the dental, vision, and hearing? Not include extra benefits. I'm sure he's typing right now. Oh, so no, those do not include the dental, vision, and hearing. It's going to be the stuff that's going to be medically necessary, like inpatient hospitalization, ER, diagnostic imaging, stuff like that. That's why we don't like to go off of the actual health costs, is because, again, if I went to the doctor 5 times this year, right, and I went to the ER twice, next year I could go to the doctor, 2 times and not go to the ER at all. So that would be the misrepresentation, is like, hey, with your age and you being generally healthy, you're estimated to pay about $560 annually. What if they end up paying $2,000 annually next year or this year, right? Brad told me that I was going to pay roughly about $560, and that's not true. That's a Section A allegation right there every single time. But that's a good question, Eric. But no, that does not include the dental, vision, and hearing and stuff like that. Now, if you want to view the dental, vision, and hearing, it's right here. So over the counter, let's see, meal benefit, which this gives you a generic version. What I always do, and what I would do if I were in the field still, I would come down to my summary benefits. And that's what I would be reading off to them. Right? So this is where I'd want to go and look at those extra benefits. Okay, so here's the hearing. You pay his $30 copayment to the specialist, to the audiologist, if it's a medically necessary hearing exam, not a routine hearing exam, right? There's a difference, medically necessary and routine or preventive. Okay, so if you want to look all the dental, vision, and hearing, you're going to need to go to the summary of benefits to get a true breakdown of what those benefits actually include. Okay. And this stuff is pretty easy. It's pretty simple to read on the actual Connecture platform, right? This will tell you it's covered. Covered. Green check mark means it's covered at a preferred cost sharing pharmacy, not a standard cost sharing pharmacy, right? And network pharmacy with preferred pricing. So remember, when you go into plan details, that means you want to deep dive into that plan, right? Now, plan details not only gives you the summary of benefit layout, or a generic summary of benefit layout, we can also take a deep dive into prescriptions. Okay, again, if I want to switch to mail order cost, 1 click, now we're at mail order cost. Okay, let's go back to retail costs. You'll have a lot of people, ladies and gentlemen, you'll have a lot of people that like to go to their pharmacy. They like to have conversations with their pharmacist. One of the social determinants of health is actual socializing, right? It's loneliness, food disparity, and also in transportation. So if they want to go to the physical pharmacy, always make sure that you have it set to the physical pharmacy, brick and mortar. So now this is the retail cost per that contract for the carrier. This is what they will pay, right? Before gap is what they pay. During gap is what they would pay during the coverage gap. After gap, which is what we call the catastrophic coverage stage. Okay, so obviously, look at Lisena Pro right here. If I go to mail order cost, And if you don't know this, Humana gives a 90-day supply for a $0 copayment through the Humana Pharmacy mail order, which is Humana's mail order pharmacy. It's not a third party, it's Humana. All right. So back to retail. So, okay, so we got a tier 2 generic, Mr. Smith. That's your albuterol sulfate, which actually isn't that bad. So that's going to be an $8.63 copayment. Here's the preferred brand name, which is what we consider a tier 3, so on and so forth. Tier 3 is a $47 copayment, right? That is what Humana is going to pay minus the $47. This is what you'll pay during the donut hole, the coverage gap. And oh, by the way, ladies and gentlemen, make sure that you come to this page and you cover all of this. We are required by federal compliance guidelines to cover the deductible phase, the initial coverage stage, the coverage gap, and the catastrophic coverage stage. Just read this verbatim. If you read this verbatim, you have now compliantly covered yourself on everything prescription drug. If you want to know what quantity limits are, if you want to know what step therapy is, prior authorization, it's all right here in the platform for you. Hang on, guys. I'm sorry. There we go. It caught back up. Retail pharmacy, mail order, generic equivalent. It's got everything on here for you, ladies and gentlemen. So let's look at what it's going to cost you month by month, Mr. Smith. So your total estimated annual cost is going to be $6,810. I can tell you right now, the reason for that cost is because of Enroll. So we need to get you with your doctor, Mr. Smith, and see if we can get you prescribed an alternative for that Enroll. Because the sheer cost, ladies and gentlemen, of that Enroll puts them in a donut hole in the first month. The sheer cost of that. Okay, because it's what the insurance company pays and what you have paid as the beneficiary of the insurance plan. If that adds up and combines and reaches that coverage gap amount, you're going to go into it. So let me show you what I'm talking about. All right, again, health costs. Don't pay attention to health costs, please. So for the first month, you're going to pay roughly about $1,900, Mr. Smith. And here's why. These ones are very minimal cost. It's this bad boy right here, the Enroll, that's putting you in a donut hole in the first fill. You see how it says the copayment and the coverage gap? So now they're paying the copayment plus the 25% coinsurance in the coverage gap. And it breaks it down for you. So as you can tell, look here. It's going to go down 1,159 from 1,896, and then once you get into the catastrophic coverage stage, which starts in the month of February, you're then going to go down to this cost. Okay, I just wanted to throw the Enroll in there so you could see what it looks like when they go into the coverage gap on this platform. Okay, there's catastrophic coverage stage right there. And again, on this page as well, everything here that you need to explain the different stages. Okay. So that's plan details. These are all the details about the inpatient hospitalization, ER, ambulance, so on and so forth. Then we got prescriptions, which are going to tell you what tiers those prescriptions are at. And if we really want, we want the total cost. I want to break it down for them. This is what they're going to pay. Now, oh, by the way, if we want to, let's say, all right, well, I'm not going to take my Enroll anymore, Brad. Okay, that's fine, Mr. Smith. Let's go back and take that off for you real quick. Come back here. The drug list is already saved to the profile. And Mr. Smith, your doctor took you off of Enroll? All right, very good. Take that off. Continue. Mr. Smith, are you still going to the same pharmacy? Or did you change pharmacies? No? Okay. Continue. Now we can look at the prescription drug list, and it's going to be much less expensive. It's actually going to be a different plan that pops up too. So look at that. It's a big difference. That Enroll is financially devastating for seniors. So again, now we have everything that we need. If you just want to go into plan details of the AARP Medicare Advantage, you can right here. And then total cost. Okay, so for the month of January, Mr. Smith, you're going to pay $54. Then once you get into February, you're going to pay about $104. Actually, I'm sorry. Look what I did. I incorporated the health cost there. You're going to pay about $54.39 for all those drugs. Okay. All right, Mr. Smith, that's your plan. Go ahead and grab your red, white, and blue Medicare card, and I'm going to get you enrolled in the AARP Medicare Advantage Choice Plan 2 PPO. That's going to be a March 1st effective date. All right. I just assumed the close. I went over everything with them, benefits, drugs. And then also we're going to need to go over doctors, of course. Maybe I should have done that. But again, just come down here. Provider directory. And it takes you right to the provider directory. That way you can verify that the doctors are in network. And ladies and gentlemen, if you are not aware of this, the number one reason for Section A allegations, and it's interchangeable with another, is misrepresenting the network. Saying that a doctor is in network and they're not. Saying that a doctor is accepting new patients and they are not. The other two that are interchangeable are going to be misrepresenting the actual co-payments, like for hospitalization, so on and so forth, and also misquoting prescription drugs. Okay, so use this platform. Now, another thing that I'll show you, and I'll open it up for questions to everybody. The other thing that I'll show you is, let's say I want to see every single plan that is available in this service area. The system automatically defaults, ladies and gentlemen, it automatically defaults to only the plans that you are licensed, appointed, and ready to sell for. So if you're like, well, I'm not seeing insurance company A, just come up here and push click on add non-licensed plans. When you add non-licensed plans, it goes from 47 plans to 64. So now it's showing every single plan available in that service area, which I do not recommend while you're sitting there at the dinner table with that client. Okay. The reason being is it's going to show some plans that you may not have. All right. And if you want to go back to show plans that only I can sell, just click this box right here. And now it's only going to show the plans that I can sell. Stay on this one. I would only use the add non-licensed plans to do my own research, my own personal competitive landscape research. And that's it, ladies and gentlemen. Up here, you can go to your account overview. Up here is your profile or your client's information for their profile. You can hop to any one of these points in the profile. You can add new profile. You can search beneficiary. Or let's say you already know of a plan, right? Just come up here and hit plans. And you just want to look at what plans are available in that service area. Just hit plans. And this, sorry. This is not tied to any profile. There's no drugs tied to it. There's no scope of appointment tied to it. This is just a quick quote. All right. I want to come in here real quick. Okay. I know Simply has a good D-SNP plan. There's the Care One Plus, which is a 5-star plan, which is year-round selling opportunity. And let's send them the Care Needs Plus. All right. Compare now. And then send quote. And that's everything that I wanted to show you guys. It went a little bit longer than I expected, so I do apologize about that, and I appreciate your time. So now I'd like to open it up for Q&A. Who has questions?
Perfect, Brad. I'll go ahead, Todd, and ask the question in the Q&A here from Cindy.
That'd be great.
Okay, perfect. So Cindy asks, and I think I already know your answer on this one, Bradley. If we are with them and know their Medicare.gov sign-in info, can we sign in to that without emailing them? So this was regarding pulling their prescription drug info on that prescription list.
Cindy, that is a great question. Yes, if they give you authorization. Do not do anything with their accounts or their logins without their authorization. Because if they find out and they don't realize what, maybe you were just trying to be benevolent, right? You're just trying to help them out, but for some reason it ticks them off and they go and complain to a carrier, to CMS, that potentially could be a Section A compliance problem. So
okay. And one more question here from Peyton. Is this platform going to be used or going to be expanded to include under 65 health insurance?
Oh, Peyton, that's such a great question. I love that question. No, it's not. Connecture might have a different platform for under 65, but that's I have no knowledge of that. But no, this will not include under 65. You got to have a different login for under 65, I believe, is what Connecture told me, because I'd asked that question back in May of last year, and they said no, we don't have the under 65 tied with the Medicare login. So he didn't say that they did have the under 65, and he didn't say that he didn't. But I can tell you right now that on this platform that you'll get with us, there will not be under age 65, no ACA.
Okay, one more question here from Eric. Health assessments are treated how?
Oh man, Eric, you're on fire. Okay, so health risk assessment, the HRA, the member care assessment, whatever you want to call it, that is going to be added by the end of Q2 of this year at the absolute latest. They're working on how to build that out, because one thing about this platform is Connecture gives the carriers access to upload all of their specific information. So what Connecture is working on with each carrier right now that you see right here, and again, we've got 4 more that are going to be getting added, is they have to build system integration, right? That's on the IT side, and that's completely over my head. So they have to build the integration with each carrier to click the button and go do that member health assessment or the HRA, right? So that is not on here yet. So what you would need to do is just be cognizant of where you need to go to do that member care assessment. Let's say for Humana or for United Healthcare or for Aetna, because you can do those outside of the actual application. So that's a great question. That's not on, but by the end of Q2, we will have it. And when we get it, you better believe I'll be giving you all another training on it as well. Is there anything that anybody wanted me to like kind of go back over or show?
I know we do have one question from Eric. Do LOA agents look different on this screen? I'm assuming it's this was kind of the early on part of the training.
Oh, okay. Do LOA agents look different on the screen? No, it's gonna look all the same. Unfortunately, because the upline would be One Life America, it's gonna be branded as us. But when you send your personalized URL, it is gonna have all of your agent contact information up here in the top right hand corner. So it'll have your agent information right here. But that's a great question. I'm sorry I missed that before. Peyton, great question. Does this platform have a sandbox to play around in? I am waiting on Connecture to send me that. As soon as I get that link, I'm going to send it over to Todd, and Todd will be able to share it all with you. But just know, ladies and gentlemen, and I didn't show you what the application looks like, and I can do that if you guys want, or maybe I can do that at another training. But just know that when you get access to this, if you submit an application, it is live. So do not submit a live application, or do not submit an application through your regular login. You will know if it's a sandbox because it will say sandbox right here from what Connecture has told me. If it does not say sandbox, which I don't have the link yet, ladies and gentlemen, so I apologize about that. But if it does not say sandbox, you can go in here and create as many different profiles as you want, right? I mean, you can create 100 different profiles just to get practice with it. So long as you do not submit an application, you are 100% safe. You can send SOAs to yourself as well, like I just did with Todd. That's a live SOA. I mean, it doesn't have to be submitted because there's no application submitted, but you can do anything that you want here. Just don't submit an application until we get you access to that sandbox environment.
There's another question here from Eric. Are we able to download all of our customers' data from this platform?
Okay, that is an awesome question. So right now, I believe I'll have to get back to you on this specific time frame, but it's either by the end of Q1 or Q2, they are going to be releasing a new systems integration. So to answer that question, that's going to be a 50-50. Yes and no. I'm not quite sure. They haven't provided more information to me on that aspect. They said as we get closer to the release window, they'll give me that information. But I can tell you right now, Eric, that's probably one of the most asked questions that I do get is, can I integrate this data from this platform with my CRM? And I know that they are working on that right now. As to the extent of it, I'm not sure. So I apologize about that.
Does anyone else have any more questions? Great questions, great questions. Great product, great product. An easy way to save time and write more business, basically. So it's all at your fingertips there.
Yes, it
I
is.
don't see any other questions here. Sounds good. Well, hey, I will email everyone on this webinar the link to get registered for this. If you have any questions, feel free to give us a call here at Senior Insurance Marketing. Our number is 877-800-3080, and be happy to get you walk you through this. Or if you're not contracted with some of the companies and want to get contracted, give us a call. We'll be happy to get that contracting paperwork started for you, so you could add that company to your registration for Connecture as well too. And again, Brandon and Bradley, thank you for your time. I know let's do maybe a webinar kind of walking through the application process as well too.
Yeah,
it was a
course.
great opportunity, and it's a great platform at your fingertips there. Also, I just wanted to plug to you guys as well too, if you're not using an e-calendar, I would definitely encourage you to use an e-calendar. I have personal experience of doing an e-calendar on another business I have. It's not insurance, but did over 500 visits with an e-calendar. And basically it's a way for technology to work for you, and so you can make more sales. So if you want to know more how to do it, I'd be glad to show you kind of how I had my setup and everything like that. And so basically, while you're sleeping, you can get appointments, and either be a Zoom appointment, they can choose the option, or an in-person office visit as an option as well too. It's easy to use. If I can do it, you can do it as well too. So give me a call, and I'd be happy to walk you through an e-calendar as well too. Just another way to enhance your business and make more sales as well. So again, Brandon and Bradley, thanks for your time. A great tool here. It's all on this this website here. It's everything you need is on one website here. So give us a call, 877-800-3080, and we'd be happy to help you out, because we're here to help you grow your business. Take care, everyone, and have a great day.
Thank you, everybody. Thanks, Todd.
Thank you.
Thanks, Todd.